So, welcome. This is, I don't know which podcast this is, maybe like my fourth or fifth, maybe even sixth podcast that I've done. So, currently, right now, I'm in LA, and the entire reason that I literally flew across the country was to see my good friend Mike DellaCorte, who is, every time I try to, when I'm back at home, I try to explain who you are, who you are, I say weird sports masseuse, chiropractor, magician, voodoo healer. How would you how would you describe it?
Very kind of you, man. So, hi everybody. I'm Michael. It's a pleasure to be on your podcast here, David. I'm a sports chiropractor, and I specialize in active release technique, which is a manual soft tissue therapy treatment. It's picture the most specific massage you've ever had in your life.
So ART is an acronym. Yeah. So what is it? What are the active release?
Active release technique. Okay. Yes.
So. And it's interesting because the way we met, we were at a party of a mutual friend in LA. What was it, 2 years ago now?
About 2 years, yes.
Yeah. So
maybe perhaps even longer.
Yeah.
Longer than that, because it was in Sherman. We were in Sherman Oaks.
Yeah. So we probably met something along the lines of at an expo.
It was at the day of the expo. Yes.
Yeah. So you or I think one of our other mutual friends mentioned the super healing powers that you're able to do, right? And I was I want to I want some. And you were I'll just bring my table. I'll bring my kids to the party. So I remember we're at the party. There was a few drinks. People were relaxed, loose and goosey. Then you literally came in with a full blown table. We were whoa, it's getting serious. I want to go first. Line me up. So. And at the time, I vaguely told you, what was, wrong with my, lower back. I was all the squatting and deadlifting as a young teenager, I snapped my shit up. It's not looking good. I don't know what it is. I'm helpless. Can you help me? You were take a seat. Let's have a look. So, and to be completely honest, I wasn't, I didn't really have any, expectations. I was excited, optimistic about the process, but I was, so used to my day-to-day pain that I felt with my back that I wasn't really, I wouldn't be surprised whatsoever if there was no change, but I was you know what, let's take a stab at it. Why not? So you did a few little assessments in a few areas, and one thing in particular that I noticed is for example, I've been to chiropractors before. I've been to people that just give massages, massage therapists, hand and so just weird places that you are hypothetically supposed to help people that are injured. And a key difference that I noticed right off the bat with how you treated and assessed me versus other places that I've been to is other places they're just kind of oh, your back hurts, okay, we're just going to massage it. We're going to formula it. We're just going to hit it. Oh, something's wrong with your back. Oh, let me just crack it into place. Hypothetically, in theory, that's a good thing. That's supposed to work. But it's so vague because when someone says they have back pain, there's an infinite amount of things that could be causing it. It's it's an encyclopedia's worth. It's so vast. To just make an oversimplified generalization into okay, let's just do this. Pretty much no one's going to get better. So it's not a surprise that me going to a chiropractor didn't really change anything. Me going to getting a few massages here didn't change anything. So you, instead of just doing all that fluff stuff everywhere, you in a highly precise, fine-tuned way tested certain areas. You asked me certain questions does this hurt? Does this how do you feel when you move here? Along with getting my feedback, you're also with your hands seeing which muscles are sliding, which are not sliding, what's activating, what's not. And then you work on a few very specific areas. It didn't even take that long. And then I remember I stood up and then I bent over. Then I stood back up, and I just had no pain at all. So for the next 3 hours after that, I was genuinely mind blown because I was how is this even possible? Mm-hmm. It almost unlocked I just didn't know that one, a human could go from feeling so shitty to so good so fast, but two, just the fact that someone like you with your expertise and technique could just do that. That's I genuinely I have a high degree of respect for that, and that's just insane. That that could happen.
I'm glad that our paths even crossed, man.
Yeah.
We were able to do that. And thank you for your kind words. Precision is the name of the game.
Yeah.
And if you mentioned it before, an individual has back pain. There's infinite, as you mentioned, is
plethora of things that could be
the best way to describe it.
Mm.
Is it a muscle? It could be, if it's a muscle, there's also hundreds of different muscles that it could be. The problem might be in your hip. The problem might actually be in your low back. The problem may be in your upper spine.
Mm-hmm.
But you have to figure it out. And you're the master of the Rubik's Cube,
Yeah.
and you've probably seen David do the Rubik's Cube. It's a puzzle.
Yeah.
You have to figure it out, and you have to probe different parts. If someone's car was malfunctioning, you can't just look at a picture of the car and say, okay, carburetor's broken. You have to probe the certain parts. So as David was mentioning, when we're moving him in certain directions, how does this feel? We're assessing what's activating, what's not. And if something is too tight, you have to make it not so tight. So I remember for you, it was the ligaments. It was the ligaments in the glute area, and then the hip flexor was stuck on a couple different things. Yeah. So we just went in, freed those up, and we were able to provide them with relief. And then our friendship just elevated from right there.
And I even remember you saying that you were describing people with, damage to their body, particularly in their back region, that like far superseded what was wrong with me. And like you said that like with those people, like working with you or anyone else in this art, or like working with another like expert or specialist in a field like that, like they were able to get almost a complete like symptom relief.
That's right.
And to me that was just like so mind blowing. And what was I even getting at? Fuck. Completely forgot where that train of thought was going. Hold on, I'm gonna bring it back. But I have no idea where that was going.
Going on where others have had substantial
What I was gonna get is like the reason that like I still have the reason I still have like all these like aches and pains is like unfortunately because we live so far apart. Like that's what I was gonna get at, because anytime like I'm in LA, like I make it a priority to stop by and like see you essentially, because I know even like 2 or 3 sessions is gonna like do like exponential amounts of progress. So the reason that I'm here is literally because I blew out my shoulder and now I'm here to just get treated upon. But yeah, if we lived in the same area, I'd be squatting, benching, and deadlifting and doing all that. But I just like wanted to ask you, because I don't think I've ever fully asked you this, but like how did you go from just existing in the world to having no job occupation to maybe some job like occupation to just like leaning into the field of just helping humanity through a specific avenue of physical, treatment, and just like through like art, like therapy, explain like art therapy. Like how did you even get to that path? Were you a chiropractor first? Like what's going on there?
Okay. Well, I was in chiropractic school, and the way chiropractic school works is right when you get there, you go through your basic sciences. They would call them collectively your basic sciences. But what made you want to
go to chiropractic school?
So even before that, I was working as a personal trainer, and I originally thought I wanted to be an optometrist. I thought I wanted to be an eye doctor.
Optometrist, that's what it's called, an eye doctor?
Yep. So there's optometrist, and then there's ophthalmologist, which can do LASIK and different eye surgical procedures. But I thought I wanted to go to optometry school, and I was doing an internship while working as a personal trainer. I was doing an internship with an optometrist who, at the end of the 6-week internship, there was a couple of us doing an internship, and she sat us down individually and gave us a review on how we did throughout the internship. And she mentioned to me at the end, Mike, I thought you did very well in this internship, but I could see you more as a chiropractor. And quite honestly, then I'm 30 now, I was about 23 then. I didn't even know what a chiropractor was at that point. I swear to you, I went home that evening and applied to chiropractic school.
Wait, so you're saying that you were an intern for
an eye doctor.
Pronounce the word to an eye doctor. Yeah, so you were internship for an eye doctor, and then you had like an internship test, assessment, something along those lines, and you performed quite well on it. And then the lady in charge of those exams, just out of the absolute blue and some magical intuition that just struck upon her by God, literally just said, you know what? I could just hire you and you could do this for us, sir, but no. I think that you should be a chiropractor. Like, just my heart is like telling me that.
Yep.
Really. Like,
so that's when my patients now ask me, what made you want to go to chiropractic school? I say, God. And I'm a man of faith. I believe in God as well. I'm a practicing Catholic, but that moment has no other explanation.
Did you ask her though? You were like, did you even question her? Were you like, that's just so
not a single
crazy.
question. She said,
were you like exceptionally, talented with your hands? Did you like spin a pen around when you were taking the test? You got the finger.
Not at all.
Back, you know?
The specific branch of optometry that I was interning with her was focused on visual therapy.
Mm-hmm.
And what they mean by that is, say you go get an eye exam. Like for instance, when I would go get my eyes examined,
Mm-hmm.
I'm nearsighted, so I can see things close up. I cannot see far away.
Mm-hmm.
I'm a minus. If you look at my contact lenses, they're a -3.
Mm-hmm.
I was a -3 5 years ago as well. My eyes, unfortunately, have been getting worse, but I have never gotten a stronger contact lens because with the visual therapy, they teach your eyes how to work together as a team. So you're not giving your eyes stronger and stronger and stronger prescriptions unfortunately, my mom is a -7 now, which is way past legally blind without any kind of corrective lenses.
Mm-hmm.
So I was going through that, and it was a lot of working with people, but not a lot of moving around. So I love working with people, but it was kind of, okay, do this exercise covering this eye.
Mm-hmm.
And Dr. Randy Shulman is the woman who made this recommendation to me. She said, I knew you're a trainer. I can see you more as a chiropractor.
Mm-hmm.
And that's it. By the grace of God, I went home, applied to chiropractic school, and then I got in. And the rest is history.
Damn.
So go ahead.
I recall you mentioning that art is basically, that's like a relatively new, is it a subset of the art of the chiropractic category, or?
It's mostly chiropractors perform ART,
Mm-hmm.
but there are some brilliant physical therapists that do it, some massage therapists that do it. So that goes into, when I was in chiropractic school, when I got there, you go through your basic sciences first. So
Mm-hmm.
anatomy, spinal anatomy, biochemistry, things of that nature. Then right around the 4th term out of 10, they start teaching you how to adjust. So the first thing you learn is the hip and the low back adjustments.
Mm-hmm.
Then you go on to the thoracic spine and the neck, and then they teach you extremities, elbows, wrists, etc. While you're going through school, when you're first learning those, at least where I went, it was a wonderful school. It's based primarily on the subluxation. So basically, if the back hurts, adjust the back.
Mm-hmm.
If the hand hurts, adjust the fingers and adjust the wrist.
Mm-hmm.
I went right when we started adjusting, I was on Instagram one day,
Mm-hmm.
taking a nice break from studying, just cruising through. And I saw a gentleman who became a friend later on, Randall, who owns LiveFit,
Mm-hmm.
make a post that said, off to see my chiro, and then he tagged the gentleman who became my mentor and one of my best friends, Dr. Matt Rice. And I clicked his page, saw some of his posts, and I was so intrigued because he had so many of his patients doing kettlebell exercises and things like that, and he was doing soft tissue work in some of his posts.
And is the reason that you were surprised because, like, so I'm now kind of a chiropractor, and I just clicked on this chiropractor's page, and I assume that he's, what I understand to be a traditional chiropractor, but I'm seeing all these strange new techniques and different things. Like, what's going on here? Like, let me just do some digging. Like, this is not what I'm familiar with.
Absolutely right.
Mm-hmm.
Absolutely right. So I emailed him, and he invited me to come shadow him. And so then seeing that live, it was mind-blowing because...
And to be clear, was he an art guy or this?
Yeah.
Okay.
Yes.
So all this fancy new stuff, they go, whoa, okay, so it's art essentially.
Yes.
That's what it was. Okay.
Exactly.
Mm-hmm.
So I'll never forget. I first went in there on a Saturday. First person was having hip issues, and he starts working on the person's ankle. And I'm thinking, I'm over here, and I'm over in the corner, just. I'm like,
This is all right.
what? Then he was doing something with the ankle, and he explains why he's doing that. And then the next person comes in.
Mm-hmm.
They have a back problem, and he starts working on the glute muscles. And he's got them on the side, and he's draping the leg off the table and having them rotate like this. Doesn't even touch the back. They get up. I'm like, oh my gosh, it's gone. And so that was just patient after patient. And the adjustments were just, they would come here and there. If he deemed necessary, they would come. But going from, okay, your pinky hurts, do that, and you're done, go see your next patient, to, oh, maybe perhaps something's going on with the elbow. Perhaps the shoulder doesn't stabilize itself correctly, and that's why the pinky is taking such a brute force.
So essentially, a traditional chiropractor just primarily addresses subluxations, like in the spine.
Correct.
And their vague style of thinking is, okay, if roughly this person's region of the body hurts, I'm going to address that issue by targeting that region in whatever way possible.
Correct.
Right? But what an elite art human, or I don't know how to put it, does essentially, it's like they've mastered chiropractic, right? So when they're assessing a patient, the chiropractic subluxational adjustments just like one of like the 1,000 tools in their arsenal.
Correct.
And that's essentially what differentiates an art therapist with a traditional, almost, I don't know, stereotypical chiropractor. It's like chiropractic just basically has the chiropractic stuff, which is not inherently good or bad. I mean, it's a great thing, but it's great.
Yes.
Yeah, it's great, but it's limited. If that's your only toolkit, yeah, you can help like a good amount of people. You'll change a lot of people's lives, but you have so much more potential if you then expand upon it. To be like, for example, do something along the lines of art, because then like you said, specific chiropractic is like one of like the 100 or 1,000 things in your arsenal. You can really help people like at a massive level. When
I go back to it's just trusting what will happen, because I remember the next week when I went back to shadow Dr. Rice again, and those patients came back and they were doing so much better. After the third one that came back doing so much better, I went into the bathroom and booked my first ART course on my cell phone. I was like, I have to see this in action. And in school, they do a good job of teaching you certain soft tissue techniques, but then nothing even came close to ART. It just, what they would teach is, okay, they would call it MRT, myofascial release technique. Here's how you do MRT of the forearm. There's so many different muscles that move in different directions and need different finger motion, different wrist motion to be treated. And I do the adjustments when necessary too, but a lot of patients that I get have seen several other practitioners and unfortunately have not gotten the relief that they have wanted. And so if someone tells me my mid-back is so tight all the time, my previous chiropractor, I'd go 3 times a week and they would 2 minutes, just pop, 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 okay, see you tomorrow, pop, 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 okay. They'd feel good for an hour, but then it would come right back. And so that breaks my heart, because I don't want, I want people to be well. I don't want to see anybody in pain. So perhaps with them, I might look around a little bit. Perhaps nobody addressed, okay, your back, you're looking down like this. Perhaps we should address the muscles in the neck too. Treat the muscles in the mid-back that are just holding you so stuck like that. And then all of a sudden, a couple treatments, they've seen another person 3 times a week for 8 months, and then in 5 visits, they're in tears because their life has changed. You know
what else breaks my heart? So what I find interesting is that, say in like the physical therapy chiropractor art world, right? You have a lot of people that are essentially specialists. They become borderline geniuses at their craft, right? And there's another craft that people could also become geniuses in, and that craft is essentially, Western medicine, like a doctor, essentially, right? But it's so interesting how, for example, with my shoulder, right? I remember, so the first, because I live in New Jersey, you're not there, I couldn't just, roll up to like your clinic and get work on.
Wish you could.
I wish I could, exactly. But my first, train of thought was, okay, I'm going to go to a doctor. So I went to a doctor, and then he did a very quick, super brief assessment, just moved my shoulder around. I was like, it feels dislocated. It's like, yeah, you probably have a labral slap tear. I was like, then I started like freaking out. I was like, let's get an MRI, right? So let's say I just went down the doctor path. Likely what would have happened is, I would have got an MRI. They would have seen, okay, the labrum was like tearing like a little bit, like it's not like looking too good. Maybe do some physical therapy, and I would have went to some physical therapists, which, I mean, just how anything in life, there can be some amazing physical therapy clinics and some, atrocious ones. Like the dynamic range is just it's extreme. So, but it's just really unfortunate that depending on which route you go, like if you go down the strictly doctor path, like obviously there's nothing inherently bad about that, but like there's a lot of people, what I'm getting is a lot of people get surgery for various different like health complications when it comes to their body, when it's absolutely not necessary in the slightest, and if anything it's detrimental. Like to my knowledge, at least from speaking to you and doing my own research, like on average from a surgery, for patients to actually feel better, a lot of the times, like I don't want to say it's pretty rare, but it doesn't happen all the time.
That's right.
It's pretty common for people to actually be neutral, and if anything worse, before their surgery. Now, obviously, that's not to say that surgery isn't something that can be beneficial / deemed necessary in like certain situations, but I feel like a lot of people should do everything it possibly takes first before surgery. So what I was getting at is like you have like the, chiropractic like art pros, then you have like the doctor pros, and like if you have an issue that something's wrong with you, it's probably best to get a viewpoint from both parties, but. Don't be seduced by just like the quick fix, easy fucking surgery path, because like no, you definitely have to do like whatever it takes to just heal like beforehand. Because like didn't you were like saying you had like some examples of people that like have gotten surgery and then they just have never been the same. And you're like, like why did they get it? Because if I would have just worked on them like for this amount of time for these areas, like they would have completely been able to avoid surgery.
Mm-hmm. I'm glad you brought that up, because this is something that we were discussing yesterday. Let me preface this by saying I've had surgery on my right elbow. Mm-hmm. The ligament that connects the forearm, one of the forearm bones, the ulna, to the humerus. If you're watching this on video, here to here, you can see the scar. Yeah. I was fortunate enough to have a brilliant surgeon, Dr. Mike Redler in Connecticut. Mm-hmm. When I first went and saw him, he said, okay, let's go to physical therapy. So here's a man that would get a significant amount of money for just doing this surgery on me. Mm-hmm. And he still said, let's try some physical therapy first. Mm-hmm. If it doesn't get better, then we'll do the surgery. I did the physical therapy. Pain was still there because the ligament was partially torn. Mm-hmm. So I had the surgery. Now I had a brilliant physical therapist after as well, and now it's stronger than even before I injured the ligament. However, a couple of years ago when I first started in practice, I encountered a gentleman who had left shoulder pain, went to the surgeon, they did MRI, they didn't see anything abnormal. So then they did an exploratory surgery. There's no such thing as exploratory surgery. You don't just cut someone open and just, what's going on? If you're going to do surgery, you have a diagnosis and you have a plan.
Precise mission,
going in. So they did an exploratory surgery. It's a little bit of a labrum issue. So they went in and shaved a significant amount of his labrum off because they deemed that as the pain generator. Mm-hmm. Wakes up from surgery, twice as much pain. And it was like that for months and months and months. So the problem is, it wasn't a labrum problem, it was a mechanical issue. Mm-hmm. Certain muscles in the rotator cuff were just too tight. They were pulling the shoulder joint out of the socket. Mm-hmm. When he'd move, everything was just not behaving as it should, and it was producing a lot of pain. So fortunately, we were able to restore function to the shoulder, but it took, he went through the surgery, it got worse. Just imagine the toll that takes on you mentally. Then you have to rest after surgery. It's still not getting better. And then 6 months later, we start doing some ART on it. Even though it got better, that's still a long time of just mental destruction. So even too, if you're, not to get too much into like technicalities, but with each thing that we do, let's say I say, okay, Joe Smith has rotator cuff tendinopathy. Mm-hmm. There's a diagnosis code for that, or let's just use simply myalgia, which means muscle pain. Mm-hmm. As a diagnosis code, when I'm taking notes, I could put in M79.1. That's a code for muscle pain. Mm-hmm. There is actually a diagnosis code for failed back surgery syndrome. So that just to me is mind-boggling, because it's unfortunately it's so prevalent. But the failed ones now, if there's a problem with where a vertebra has been fractured, there's no ART protocol to put a vertebra back together. Please go see your surgeon. Mm-hmm. However, if the cause of pain does not need a surgical intervention, I wouldn't do the surgery. Yeah. But it's always better to try conservative care first, unless it's something like a red flag, unless the person's got rapid unexplained weight loss, they're waking up in night sweats, things like that. Those are cancer signs. Then you want to go, and if it's something oncological, or meaning cancerous, you need to go see a cancer doctor, or you need to go see an orthopedist. If there's something wrong with the bone itself, that's a surgical case. Mm-hmm. But if someone sits at a desk all day, hunched forward like this, or they drive a truck for 40 years and they're driving like this, I wouldn't have the first thought be surgery. I would try and see if someone can help you move better, if they can treat the tight muscles. Mm-hmm. And just going along with what you said, there's these two routes. I would always like to see more. I would like to see more people try the conservative route first before going.
And I'd also say, so I think there's a very small minority of people that pretty much just go straight to the surgery route, don't even bother getting a second opinion. Doctor said it, screw it, I'm going to do it, right? I think there's a slightly larger group of people that, go down to the straight doctor path, and for the doctors, just strictly due to procedural reasons, that they'll give you a mandatory amount of time to do physical therapy to some local, low resolution clinic that they'll just prescribe you off to, which can be effective sometimes, but sometimes it can't. So then you could think that, okay, I went to this physical therapy clinic, it didn't really help me, therefore I am 100% doomed because this one clinic failed me. That means that's it, I'm going to get surgery. I'm going to close the thought in my head that I could ever, fix this issue without surgery, right? And I feel like there's a lot more people in that category, and I feel like that could be really, really dangerous because it's almost like a matter of luck. Like, are they going to land in a clinic with a clinician that's competent enough to address their specific issue at hand? It's kind of like playing like the lottery in a sense, obviously with way, 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 way better odds. But the whole reason I bring this up is I want to, but it's like people watching, like for example, I want to give them like certain, areas that they could start, or certain people they could look into, or certain clinics or whatever they could look into for like their specific issues. Like for example, Stu McGill, that's someone that you introduced me to. Like he's just like the godfather when it comes to all things back. Like he's like simply the leading pioneer in that field. Yes. And he's written a book which you gave me, which I'm like 1/3 of the way through right now. It's called Lower Back Mechanic. It's a book basically written in layman's terms for just the ordinary person to just be able to read and be able to assess what exactly is going on their back, figure out their pain triggers, and how to stop any more pain from happening. And basically, for you to become your own doctor, for you to it's a book that basically helps you get rid of your like lower back pain, right? Yes. Essentially. So I'd say that like if you have anything off with the spine, right? I would suggest, reading some of his books. Stu McGill, or he has like plenty of YouTube videos that you could watch, or I'm assuming that he probably has like clinics or like offices that he would like throw like recommendations to or whatever.
Absolutely.
So yeah,
Absolutely.
so look into that for sure.
So you can become a McGill certified provider,
Mm-hmm.
and then on his website you can see, just like with ART, how there's a find a provider tab.
Mm-hmm.
You can find them all over. And as you touched on that, how it's kind of like a luck of the draw.
Mm-hmm.
A lot of times when these clinics, if someone has a surgical consultation, they'll take an image and they'll use what they find on the image as automatically, oh, that's the problem, let's do surgery on that.
Mm-hmm.
So if someone says, okay, my shoulder hurts, they do an MRI and you see X.
Mm-hmm.
It may not be the true problem, but they'll say, okay, let's do surgery on X.
Mm-hmm.
That's what's jumped for it. If not, they may say, okay, the person says, I don't want to do surgery, can I do physical therapy? Okay, so they may refer them to a clinic that they're in network with, and you don't know, unfortunately, what you're going to get. Because let's say they send them to a physical therapy clinic that they have a connection with. Yes.
Yeah.
Let's say the person's been doing physical therapy for years. They feel like they've done their time. They don't want to take the time to individually assess each person. And now they've got a couple sheets where, okay, shoulder pain, stretch 1, 2, 3, 4, 5 for all shoulder pain.
Yeah.
Your hip hurts. Okay, let's give you this sheet of boom, 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 boom. But like we said, no shoulder pain is the same. No back pain is the same. Every single person is different. So let's say now your back hurts, you were given these 5 things, they didn't work.
Mm-hmm.
What do you tell your friends? I tried physical therapy,
Exactly.
It doesn't work.
Yeah.
Then that's unfortunate.
Mm-hmm.
So that's why another reason I fell in love with ART or just any system in general.
Mm-hmm.
Because let's say, like we were doing for you, if your infraspinatus and teres minor are glued onto your glenohumeral, your shoulder capsule, I know exactly how I'm going to treat that.
Mm-hmm.
Because of the protocol that Dr. Mike Leahy came up with for that. So you know what you're going to get, right? And I just wanted to touch on that. As you mentioned, like it's kind of a lottery.
Yeah, and I feel like a lot of it almost kind of comes down to passion, how you were saying, because you were giving an example of like, you're the physical therapist, you fucking show up to a job, you don't really care, oh, this schmuck is like shoulder hurts, like where's the shoulder files at? Okay, stretch, I'll put on my glasses, stretch, 1, 2, 3, 4, 5, okay, just do it, did you do it? I don't know, I'm not even paying attention, just say you did it, so I feel, okay, he did it, okay, send the fucking baby back to the hospital, it fucking failed, get the surgery, right? So there's an issue of just like a lack of passion, and there's also an issue of kind of how you were saying, there's like a weird, like, is usually, a lot of the reason that doctors like prescribe pills more rapidly than they normally should is because there's a financial incentive for them. Just like there's a financial incentive, for example, for some doctor clinic area to offset their patients to a certain physical therapy clinic or whatever. So there's like this almost like invisible, like, I don't want to use the word conspiracy, but there's this thing happening where the deepest intention and desire is one that is like a monetary one. And like just keep things moving, check the box and keep going, rather than like a true holistic, like, how can we help this person as like as much as possible one. Mm-hmm. So I feel like that's like useful to know when it comes to just don't fall for the authority figures. Like obviously, a doctor's gonna know more about the body than you, but don't just take their absolute word for it just in general because you perceive them as an authority, right? Like, don't be seduced by the power stature of like the medical system, what your doctor tells you and your physical therapist, like you did a few things and it doesn't work. So no, definitely go out, get different opinions, right? Because like if someone like comes across someone like you, like they're in extreme luck versus coming across someone else.
Appreciate you, man.
But
I'm sorry, I didn't mean to cut you
off.
No,
so I was gonna say, just to like almost close a loop on that. So just for the average person just like watching at home that maybe hasn't even gone to like a doctor yet, but they want to start learning how to rehabilitate their injuries or anything that's wrong with them. So the one person that I really know is like Stu McGill. When it comes to the back, definitely look into him. Do you have any other people for maybe like shoulders, knees, hips, or anything like that? Or if not, do you have, for example, like certain clinics or certain areas that people could like look into to like start looking in the right direction for like passionate treatment.
Oh, absolutely. Now, let's start with more online authorities, because with Dr. Stu McGill, he's retired. He was a professor for a long time, so you'll get his presence online.
Mm-hmm.
So his website, BackFit Pro, is a great source. Many articles that I've sent you, I took from his website to send to you.
Mm-hmm.
Another is Dr. Craig Liebenson. He's C. Liebenson on Instagram. Dr. Matt Rice on Instagram. Gray Cook is another great one. Dr. Greg Rose, another great one. Some strength coaches are great resources too. Ben Bruno, Dr. Brett Contreras.
Yeah, the glute, yeah.
The glute guy, yep.
Mm-hmm.
Who else? Dr. John Rusin is great, the strength guy. And I'll, perhaps if you can type them in the, if I think of some other ones as well.
Put them on the screen if you send them later.
And again, just as a disclaimer, I have a very close friend who's an orthopedic surgeon. He's a darn good one too.
Mm-hmm.
He does surgery when necessary, and he gets fantastic results for his patients. And his success rate is so high because, let's say, if someone truly has grade 4 labrum tear, he's one of the best guys to go in and fix that up. But if a hip case doesn't need the surgery, he's not going to go in and do surgery.
He has such a high success rate because he will only do surgeries when he knows nothing else will work and he knows exactly what to do. Mm-hmm. So the doctor that doesn't get a lot of successful surgeries is a doctor that's doing surgeries in areas where he doesn't have any business doing them at the time, which is why a lot of people report issues afterward and they blame the surgeon. Oh, the surgeon did a bad job or he's a shitty surgeon. Well, no, just the whole procedure in general was invalid from the start. That's why you have an issue, not because the surgeon's poor.
Yes.
So
I get a lot of referrals from a medical doctor who practices right in Pasadena, so about 15 minutes away from here, and she originally came in because her neck was unresponsive to any kind of NSAIDs like Advil or anything like that, or even anything a little bit more potent on the anti-inflammatory scale. And she came in, we did a couple treatments, and she did really well. So then she started referring me some of her patients where they were having sciatica or headaches, and they were doing really well with treatment. But going from the other end of the spectrum too, there are also ways where, let's say, this woman came in with sciatica symptoms, and unfortunately it had been there for about 40 years, and there was scar tissue built up 360 degrees around the sciatic nerve, and we couldn't get her any relief. So I referred her to a surgeon who did a surgery because we knew the cause was the scar tissue wrapped completely around the nerve. He went, got it, she's pain-free now. She's doing fantastic. Another person had, we tried to go conservative approach, but he had a fracture in the back of the vertebra. So one of the vertebrae, we've talked about this before, a spondylolisthesis, where one of the vertebrae go forward a little bit. So if that's mild, you can manage that conservatively, and he was right on the cusp, really didn't want to do surgery. So we gave it a shot, but it came to a point where we weren't seeing a big increase. So then he went and did a surgery for a specific one for that, and we still stay in touch to this day. He's 100% pain-free. So now, I say that just as a disclaimer. Sometimes it is necessary, but surgery has such a high success rate when you surge on something that actually needs to be surged upon. If I came to David, if I may add, if I came to David and said, David, my thumb hurts, and you say, okay, what's going on with your thumb? Why does it hurt? And I say, oh, well, every day this guy, Brendan, hits me every day 10,000 times in the thumb with a hammer. Mm-hmm. Your orthopedic surgeon, Dr. David Lathe. You say, remember, B. Myers 10,000 times with a hammer. My thumb hurts. Say, all right, Mike. Take an image. Oh yeah, you got a little boo-boo around the joint capsule right there. Perhaps let me run your insurance for about $50,000, and we'll do a little surgery.
And for half off, I could just amputate it and put a prosthetic in.
Yeah, perhaps. We'll do a little sum. There, we'll call it sum. Do you think that would help me, or just take the hammer away?
Yeah, but usually the person, I don't know if you said me as an example, the surgeon or whatever, is like, he's unable to even see the fact that there's a hammer there, because sometimes he wouldn't even bother to ask, because he has tunnel vision on like what's happening here that he can't take a broader view and like see what could there be a hammer hitting it, like, and that's the issue. So they could be so good, so competent in their field, but it's simply just looking at things the wrong level of analysis, not having the broadest view possible, which is all it is. What even was that? All it is just literally just a simple change in perspective. It's so subtle, but if your perspective is even miscalibrated a little bit, like, it could, not to sound apocalyptic, but it could do catastrophic harm, like, essentially.
Yes.
Yeah.
It's, I and keep in mind, I do like the tunnel vision as well, but down the line.
Yeah, that's tunnel vision. Like, when you have the broad view first and you kind of get everything, you understand it, then you can laser it in, and then when you really pinpoint it, then you just hit it with 10,000 joules of tunnel vision energy, and then you like handle it. But if you just randomly go take the tunnel vision laser and just go there and like shoot, you could be shooting in the wrong area. You need to see the whole thing first.
That's exactly right. And when you start with the assessment process, you look at the person as a whole first. And get an idea, okay, the left shoulder is the problem. But we also need to take a look at the hip on that side and the mid-back as well, especially in rotational athletes like golfers. Oftentimes, if there's a shoulder problem, every golfer that I've treated has had an opposite side hip problem too. Just from rotation. Same with fighters, things like that. A lot of times, if there's an issue on one shoulder, they've got an opposite side hip issue. So it's just knowing, okay, let's look at everything as a whole first. And then once you have your vision of, okay, I need to go thoracic spine, mid-back, and I need to go left shoulder, and I need to go neck as a whole, then tunnel, spine. Okay, problem, got it. Look at neck, problem, got it. Shoulder, problem, got it. And then go tunnel again on each of those and fix it.
Like, for example, like another parallel or like similarity that you can make to like the world like medicine again. For example, let's say you have like a patient and then you're like a doctor and the patient's like, oh, low energy, like I don't know why, like I just can't focus on things, I feel terrible. Boom, slap Adderall prescription, right? No deeper investigation. What could have happened is like, for example, that patient could have taken too much antibiotics when it wasn't necessary years ago. They damaged like their microgut biome, like they weren't able to absorb certain nutrients, right? Their diet is suboptimal and their lifestyle and sleeping patterns are also dysfunctional, right? And then there's a cascade of many, treacherous things that happen along the way. And one of the surface level end results of that is the feeling of tiredness and the lack of the ability to focus, right? So the doctor, it just immediately slaps a laser on, okay, you hard to focus, like you feel tired all the time, boom, let's just give you the Adderall. And it's just like, or whatever prescription would like heal it, but like that's just like an example of like, it's just not looking at things like from the zoomed out, like proper, like viewpoint. And it could literally, and this applies like everyone, not even like in the field of like medicine. Like I could even make a correlation with like people in like bodybuilding, right? Like, for example, like, okay, so like you can have a someone that's just like a newbie, like someone that's beginning like lifting, they're beginning working out, right, and they're like skinny to the bone, like there's no fat, no muscle, super skinny, and they start like working out, right, and they put on like a little tiny bit of muscle, and they're just like super concerned, like how do I get my upper chest big, like I just want to get that nice like just big upper chest, and just do all these reach and all these upper chest exercises, like should I do my upper pec fly like this and rotate it in, should I wait this amount of time before like doing my next set, like listening to this music, increase the frequency of the myofibrillar hypertrophy, the growth of the nucleus apex point of my chest, blah blah blah. It's like you're going so intense with such laser beams, the wrong level of analysis. Like you don't even have a chest first to like start being worried about which part of the chest is big or small. Just work on getting your chest bigger in general. And the way you do that is just like just like lift weights and like focus on getting stronger, to eat more food. Just zoom out, get those basics right, and then your issue will kind of like solve itself, rather than just like tunnel visioning into something that's like it could seem like you're on the right path doing the right thing, but it's just you're addressing things at like the wrong level. So I feel like the whole lesson in a whole that could be like drawn from this is like, I don't know how to put it, just like a zoom back view and just like try to be like smarter about it and like look at all the variables that are at play.
Yes.
Like playing with each other.
To touch on both of those, to touch on the being tired and fatigued all the time, think of, you zoom out for a little bit, how you feel your energy levels are highly regulated by your adrenal glands. A lot of times people will say, I'm dealing with adrenal fatigue. That's when just tired all the time leads, it can bring about feelings of being anxious, anxiety all the time. And what if instead of going right for an Adderall prescription, what if you ask that person simple questions about their daily life? So how often are you sitting? 12 hours a day. What are your stress levels like? Super high, through the roof. Zoom out even more. Okay, if they're sitting all day, what's probably super tight? Psoas?
Yeah, the psoas, yeah.
Psoas goes from here up to your spine. What sits right on top of the psoas on both sides? Kidneys. What sits right on top of the kidneys? Adrenal glands. So if super tight, pulls down, that might be factoring into the adrenal fatigue. So you might not fix it, but you certainly can help. And maybe perhaps that'll give the person a little boost of, wow, this is pretty liberating. Perhaps I'm not going to be stuck being so tired all the time. And that's one of the most fulfilling things about the job is being able to provide a sense of liberation to those whom they feel I'm doomed. And then you can do a couple moves, and when they walked in the door saying, okay, it hurts when I scratch the back of my head, and you say, okay, let me scratch the back of your head now, and they say, oh my gosh, it's better. It's okay, awesome. Look at what a change we can make in 5 minutes. Now, wait till we get, that's not even fully healed. 5 minutes, it's impossible. But let's say we get it fully healed. Imagine how great that's going to feel.
Yeah, and how you were saying that example of like someone like having like adrenal fatigue, and then like a hypothetical scenario to why that could be happening is if they're sitting 12 hours a day with tight psoas, compressing everything and like causing suboptimal adrenal gland like activity, hence resulting in the adrenal fatigue. But like, for example, if the psoas is released, the person maybe has better posture when they sit, or maybe they try to sit a little bit less, take some brisk walks in between like their cubicle, desk job, etc., whatever, just be more active in general. Like it could almost clear up the issue entirely if that's like primarily what it was. But it just right off the bat, it just doesn't, like, to the ordinary person, just the concept of like I could be getting adrenal fatigue because my posture sitting down is slightly more crunched. It seems like two such separate events that have absolutely no correlation, no tying in whatsoever. And that's what it takes, almost like an artist, someone like you, to be able to just like see all the fucking maneuvers and acrobatic contortions of like an abstract connections between those two like events, like essentially, right? And yeah, I mean, I feel like just in general, it's insane how things in general, two separate events, a cause and effect, could just be so so many things at play. Like your neck could be hurting you because literally like a bone in your toe, just like just things like that. It's just it truly is like it's insane. And I feel like we could even like unpack like what happened to my shoulder specifically to give like a relevant example that we literally just like wrapped up. But literally like I was like I mean obviously you know this the whole gist of like what happened with my story, but for everyone that doesn't know, about a year ago I injured my shoulder. Right, I was like wrestling with one of my friends. He was like 40 pounds heavier than me. I have no idea like why we were even doing that. I was like silly in general, but I was in a position with my left arm where it was. I'm using my right arm as an example now because it's healthier than my left at the moment. But my arm was like up and back, and then I just heard like a loud, just ripping, snap, crackle, pop sound, and then it was like agonizing pain for a few minutes, and then it went away, and I was like fine for a little bit, but it took like a few weeks for me to be able to kind of start working out again. I could mainly do pulling motions. Then this happened a year ago, and over the course of that year, I've like re-injured the same area just a few times, like maybe like 3-4 times. It could be something as simple as, this is an actual practical example of my phone literally falling down in the shower and me throwing my arm down to get it, and then like something just wasn't right, intense motion, like shoulders in shambles again. So my shoulder would heal like anywhere from like 95 to like 98% healed. And what I mean by that is like the muscles are strong, you know, I could work out, I could lift strong weights, I don't really have any pain, but what I do have is a slight feeling of instability and just the shoulder not being the same as my other healthy shoulder. For example, like if I'm benching, I have to be just a little bit more tight, like it just doesn't feel the same. And an example of like me dropping my phone in the shower, like what's going on there is the muscles are healed, but they're not healed, and their strength isn't in correct proportion to how the healthy shoulder anatomy should look. So that makes it so my shoulder is not perfectly aligned in the socket, so it's slightly out. So all it takes is the shoulder to be ball to be slightly out of the socket with an intense motion, and I could just re-injure again. So I just keep getting re-injury after re-injury after re-injury. My most recent version of the injury is I was playing badminton and I dove to try to hit the birdie, and then I fell on the ground and I used my arm to brace my landing. And the same concept, this arm is bracing the landing, the ball is slightly out of the socket, combined with intense impact. It being slightly out of the socket accelerates to drastically out of the socket to that intense motion, boom, and all those same muscles just get snapped up again. So literally when that happened, I just sat there. I was like, you know what, this is like, I almost looked at it from just like a karma like standpoint. This is just like, it's just meant to be. This is like the universe essentially punishing me for not doing all the necessary steps and precautions and rehab, physical therapy, etc. to literally get it to heal properly. So now I know I need to fly to LA and get you to like tweak it. And then, I mean, the thing is, I knew without a doubt that you'd be able to like decrypt the whole thing and like fix it, which I was 100% right. And so when we worked upon it, like, we use like the Rubik's Cube analogy. Like you did this whole assessment, you asked me questions, you moved my arm around, and then you notice like, I don't even remember all the names of all the muscles, but there was like so many things stuck together, muscles not sliding correctly, so you pinched, you released, you got some things to flow right, and then as soon as you did that, you noticed something else tightened up there, so then you had to go and you had to like de-tighten that, and something else popped here, then you had to work on both of those areas, and one of the areas that you already worked on started re-getting tight again, and you had to go in there and keep tweaking and turning the Rubik's Cube until you were like, you just solved it, right? And it was like in its perfect state of being solved for a second, and then you're like, David, move your arm around. And I'm moving my arm around, like, whoa, this is literally insane. This is crazy, right? But what's interesting is that feeling would only last maybe for a short amount of time, maybe like a few hours or so, because then it would slowly start going back, because kind of like how you would say, it takes multiple, that has to get treated multiple times, and also the muscles that are now activating and firing correctly need to be reinsured. They need to be continuing on that path, which is why you would give like a physical therapy routine where I would have to do certain exercises to make sure those muscles keep firing in that same way. And then basically I'm assuming after a few weeks of me doing that, the shoulder is going to be healed. But it's just crazy how there's like a lot of people that, you know, maybe injure their shoulder playing baseball, doing this, doing that, and it's just never been the same, and they feel like it's just going to stay that way for the rest of their lives. But if they just have someone untangle the Rubik's Cube, it could just,
it's worth it to get it checked out.
Super worth it.
I want to touch on, you know, the power of not precisely fixing something, because as you mentioned, it would get to 90% improvement, but we never got that 100, and then it would go back to, it would re-injure itself. As we were touching on in the YouTube video as well, when muscles get knots in them or knots between them, it's like a pause button or an off switch on the muscle, and it can't fire appropriately. It can't work appropriately. And with yours, there were so many little intricacies where we had about 1 millimeter to work, where the front deltoid was stuck to the bicep. The pec was stuck to the bicep. Serratus anterior was stuck to the subscapularis. Even if you've got a problem in just the serratus anterior, it's going to mess up
a lot of
shoulder motion.
Yeah.
I see it in swimmers all the time. Let alone if it's stuck to several muscles neighboring it, as it was for you, it's going to create a whole cascade of problems. So we were mentioning this yesterday too, how when we take, let's say it comes in, let's say we come in and we've gotten, let's say you're here. For those watching on the video, let's just say, you're on a ruler and we start at inch 1. We need to get you to 7. 7 is pain-free. You do it and you probably get it, let's say we got you to a 3. And then a couple minutes later, it settles back to like 2.6.
Yeah.
That's great. That's still an improvement from the 1. It's just when
you're good.
When you go, especially in that moment, even if you can make a small change, that's great. Let alone making. We made a pretty nice change. And then, as David was saying, it's going back. It's the importance of retesting, right? You can do it. Okay, that feels better, but that doesn't mean the problem's solved. There may be something still going on. So we would go back to it with you, say, okay, it feels better, but there's still a problem underneath the arm now. We go underneath the arm, wait a minute, something tightened up near David's neck, okay? We've got to, and that's just the finesse with it. You've got to just understand, okay, if now when we go palm down towards the floor, for those who are just listening, it hurts in the back. Okay, let's see what's happening with that. Oh wait, it's a problem actually underneath the arm again. Retest it. Wait a minute, that feels better, but I feel it in the front now. Okay, so let's keep going around, because certain things change. So that's just something that we were going out with you, but the importance of getting it addressed, especially if you've got something it's almost better and it keeps coming back. It's nice to just have a plan of action too.
Because how you were saying was, so you have like a ruler that goes from 0 to 7 inches.
Yeah.
Say right. Strange ruler you got there, but so basically 0 is no pain whatsoever. 7 is maximal pain. 7 out of 7. So normally a person is 7 is maximal.
Well, let's say 1 is where they are right now and it hurts a lot. Once we get you, so we're moving, let's say we've got a marble at 1 and we're trying to move it along the ruler, and once you hit 7, I'm sorry, I forgot that I just completely stopped on that thought train, I'm sorry. Once the marble gets to 7, the pain's gone. So in session 1, let's say with you, we went from 1 to 3. Take your hands off you. Wow, this is great. It goes back to about 2.7.
It's like a yo-yo. So initially, with someone with no treatment, they're just going to be hovering right here.
Yes.
And after a proper treatment, they'll blow up here and be like, wow, like they're not fully. They're halfway healed. It feels great. Then it's going to trickle back a little bit. And let's say that was the only treatment they got, it would very, very, very slowly probably come back to 1. So the importance of getting retreaters, you explode, go back. Then next time you explode, you go back. Then you explode, then you go back. Then you explode, you go back. And then eventually you'll get to the point where this starts becoming your body's new default, right? That with the physical therapy also solidifying and calcifying that new state, like that's how you get back. It's like 100%.
So when you came in today for your follow-up, the first follow-up, we say, how you doing? Better than yesterday. Outstanding. We didn't completely fix it. Thankfully we've got more time while you're here in LA. We're going to keep making strides. But I anticipate that tomorrow you'll come back even better than today. Mm-hmm. And then we'll keep going. And then once we get you to that hypothetical 7, mm-hmm. keeping up with the rehab and everything, make sure serratus fires. Remember, we've talked about reactive stability with mm-hmm. you. That was the thing for your viewership with the dropping the phone in the shower. Mm-hmm. Remember when we were doing yesterday, one of the things that you were mentioning to me, because I was looking at my notes again from before you came, one of the things that you mentioned was when you would set everything 100% neural drive, okay, focus, boom, then you'd make the move, you were okay.
Yeah.
But if you go for it, mm-hmm. there was a little bit, it felt like it was going to dislocate still.
Yes.
So with the phone, phone's falling.
Yeah.
So we're not thinking, wait a minute, mm-hmm. let me get serratus going, subscap. Okay, now I'll go grab the phone. It's like, man, I gotta grab this phone, it's gonna fall.
Yeah.
So when you just go for it, especially after your wrestling and then the badminton injury, mm-hmm. if this is not in a good position in the socket, and like this.
I like how you just phrase it that way, because that explains why I was essentially able to work out proficiently with being 98% healed, because I'm not doing any MMA jiu-jitsu or some explosive, spontaneous movements, right? I do pretty much the same movements every single time. They're all calculated. Mm-hmm. I get all my tightness, all my pressure, which explains why I could still bench heavy weight. I just make sure that my shoulder's nice and in its place. But when it's a situation where I don't have time to brace myself or set myself up, that's when my true vulnerability, that's when that 1% turns into a massive, massive, massive problem.
Yes, sir. Yes. And our goal with you is right now we have to be as locked in with everything that you do. But remember, it doesn't have to be like that with every move forever. Because remember, we've talked about, even before when we first met, remember when we would hop on the phone and you would ask me, hey, what are your thoughts on Brazilian Jiu-Jitsu? What are things like that? Mm-hmm. If someone is going to try and put you in an armbar or a kimura like this, you can't say to your opponent, wait a minute. Mm-hmm. Okay, go ahead. Yeah. It's got to be able, if you get put in a compromised position, our goal is for you, okay, just tap, come right out, and go back into competition again. Go back with your opponent. But for right now, in the rehab stages, it's very important for David to be very, very locked in and very
tight, controlled,
intentional. Mm-hmm. Yes, with his bench press, with his kettlebell work, with dumbbell rows, even with if you squat, lock in. Mm-hmm. Like I know you do very well, but it has to be done intentionally with every rep. And our piggy bank example, let's say every time...
Stu McGill's piggy bank example.
Yes. Thank you, Dr. McGill. Mm-hmm. Every time you make a good move, every time you set your shoulder blades, you're ready to go, you put a penny in your piggy bank.
A good move being something done at full range of motion successfully with no pain.
That's right. Mm-hmm. When each time you do that, you put a penny in your piggy bank. Mm-hmm. When you get to $1, then we can have you go jiu-jitsu, Muay Thai, bringing unexpected events into the equation. Mm-hmm. But in this, until you get to $1, it's not detrimental if you make a bad move. It's just you take a nickel's worth of pennies.
Yeah. So every time you make a bad move, aka doing the full range, doing a range of motion while having pain, it's gonna be a nickel rather than a penny, because it's just exponentially, you're just making things worse. So you just have to. It's a slow and compounding building process that you have to just build up over time.
Yes.
And just get all the proper firing patterns on point.
Because that also goes around along with sliding our marble on our weird ruler from 1 to 7. Mm-hmm. It's based on and I hope that example makes sense too, where one is a lot of pain, person comes in, after treatment number 1, the marble slides to 4. Now, if that person makes a ton of just unintentional just moves, they might even slide back to like a 1.3 or even a 1. They might go back to how it originally was. But if the person's very intentional, it may not slide back much at all. So then you intervene again, and it goes even farther up the ruler, and they feel even better. Now, just as a disclaimer, I always, I'm not in it for the money. I'm in it to help and serve people. So each person that comes in gets my full effort, and as much as I would love for it just to be, oh, here you go, okay, and then all of a sudden fixed in one, I would love that. It just, it doesn't happen often. I've had just a couple people where it was just one shot and then went away, but also those folks weren't dealing with the injury for a long time, and the build up to the injury was not almost long awaited as well. It wasn't like there was somebody just kind of tapping you with a hammer.
Picking the scab, yeah.
Exactly. Nice Dr. McGill reference there.
Right.
There wasn't somebody just kind of tapping you. But, so just to go along with that example, I'm always hoping, okay, I hope this is the one that gets somebody out of pain. But I just, from treating thousands of people, and just the ruler example is way more likely to happen, where, oh, it felt great. It still feels better. I'm not there yet. Okay, let's do it again. Let's push the marble a little farther. And then once we get to pain-free, we have to stay pain-free like that. So then, as we were mentioning before, I'm sorry to loop like that, but, I just like to, let everybody know our game plan, because our game plan is how it goes with each individual person that gets seen. Yeah.
Well, I am getting pretty tired.
What time is it?
What time is it?
10.
It's 10.
10 o'clock.
It is 10. Well, I think this is enough information for people for our first podcast. Probably going to be many, many more in the future. But yeah, so if you guys want to see my last vlog that I made, which is shows actual footage of Mike working on me, along with a just as, if not more in-depth and visual explanation of what's going on with my shoulder. You got a little iPad with the muscles and the anatomy to show the whole diagram of what was happening. You can just check that out on my main channel. And if you guys want to keep in mind, so if you have any injuries, anything wrong with you, go back to the part of the video. Maybe I might leave a timestamp here of where Mike mentioned all the top people or top places to go to, people Stu McGill, etc. Look into them. And if you guys want to see Mike, he's based in the Hollywoodish Los Angeles
called
area.
Los Angeles area.
Yeah,
it's Glendale, California.
Yeah, Glendale, California. If you're interested in the Los Angeles area, you want to work with Mike, I'll just leave all his information down in the description if you want to check that out. And
they can send me a message on Instagram too
if
they want me to
Instagram
find.
too. I'll leave his Instagram below. You're more readily accessible like that, on Instagram and the DMs and stuff. So yeah,
I'm happy to make referrals for people if they. If they just let me know. Where I live in Wisconsin, I can make an ART referral from the website for them. You can just shoot me a message on Instagram.
Beautiful. That's amazing. I think a lot of people will benefit from that. That'd be great.
My pleasure, man.
Amazing. Mike,
thanks for having me on here.
It's a pleasure.
My pleasure, man.
Cool.